Hello, good afternoon everyone. Oh, it's nice to see a lot of familiar faces in the crowd. Okay, so I've been given the dubious honor of dealing with this topic. Prostate cancer is back and how to deal with it. So I'll be talking about PSA recurrence after local therapy. Local therapy means you're just going to treat just the prostate gland itself, either with surgery or radiotherapy. So everything revolves around PSA. So PSA, means different things to the layman. And even in Malaysia, about 20 years ago, I don't think any Malaysians even understood what was PSA about. They probably did not even hear about prostate cancer. But of course, to this audience, we all know what PSA is. PSA stands for prostate specific antigen. And PSA is produced by the prostate gland. There's the prostate gland there. Some of the PSA in the prostate gland will escape into the bloodstream. And we can estimate the amount of PSA in the blood by doing your PSA test. And that is what you do when you do your PSA test. You're measuring the amount of PSA in the blood, which is only a small fraction of the PSA which is actually in the prostate gland. And the normal level of PSA is up to 4. So your prostate gland produces PSA, some of the PSA goes into the bloodstream, and you have a small amount of PSA in your bloodstream. If in addition you have cancer of the prostate, that cancer is also going to produce PSA, that PSA is also going to the bloodstream, and your level goes up. So if your level goes more than 4, then of course a urologist will say, get a biopsy, and then as you saw Dr. Rohan's slides, you have a biopsy and you confirm you have prostate cancer. So you all know that prostate cancer, there are many different grades of prostate cancer, and basically if you have a Gleason 6 tumor, those tumors are quite harmless in most patients, and therefore you don't have to have any treatment. You may just undergo active surveillance. However, if your grade of the prostate cancer is 7, 8, 9 and 10, these are the aggressive tumors and you need to undergo some kind of therapy. And the therapy is a local therapy just directed towards the prostate. And the common types of therapy are either surgery or radiotherapy. So if you choose surgery, the surgeon will remove your prostate and he will remove the lymph nodes which are surrounding the prostate. And there are 3 types of surgery you can choose. You can choose open surgery, laparoscopic surgery, or robotic surgery. If you choose radiotherapy, again you have different types of radiotherapy. 3D conformal, IMRT, tomotherapy, gamma knife, brachytherapy. They're all different types of radiotherapy. But basically, the radiation is given to the prostate gland only, and the radiation will destroy all the normal prostate tissue and also all the cancer cells in the prostate. That's how it works. The prostate and the lymph nodes are not removed, they're still there, but the radiation is supposed to kill off all these cells. And in many cases, radiotherapy is usually combined with hormonal therapy. And the hormonal therapy is given sometimes 6 months and sometimes up to 2 years. So which treatment to choose? Now this is the difficult thing. And it's important that men who have prostate cancer and who are about to embark on treatment, it's important that they receive a balanced information to help them to make a decision about the choice of treatment that is suitable for that particular patient. So before you choose a treatment, there are certain things you have to think about. You have to ask the right questions. What are the chances of cure with that certain therapy? What are the side effects? Because different treatments have different side effects. What happens if the treatment is not successful? So these are some of the important questions that someone should ask before embarking on any kind of therapy. So, where to get the answers? Well, most patients, of course, will consult the urologist, but I also tell them to also consult the oncologist, get both sides of the coin. And if you're not happy with either these guys, you can get a second or third opinion from another oncologist or another urologist. Most patients will also ask their friends or other patients who've got a similar disease. And in fact, I think Mr. Das reminded me, just the other day, when he came and saw me about 15 years ago with prostate cancer, I actually lent him my book, The ABCs of Prostate Cancer. I wonder whether it's returning to me. So basically, you have to do your homework. You don't rush into treatment. You have to do your homework. Now, of course, now you don't even have to go and buy these books. Everything's on the internet. You get a lot of information on the internet. Another useful thing on the internet is what is known as this cancer prediction calculator. These are calculators, online software, which have been developed by all the major cancer centers all over the world. You get it for breast cancer and a whole lot of cancers, and there's also one for prostate cancer.